Hello, my name is Tiffany. The purpose of this video is kind of specifically for other cancer patients who have HER2 positive breast cancer and are getting ready to start TCHP chemotherapy. I had a kind of a hard time finding videos, and I was able to later on find videos about this specific cocktail of chemotherapy drugs and the side effects and other people's experience with them. And again, everyone's experience will be slightly different. People have different reactions to different side effects to these chemotherapy drugs. But from watching other people's videos, I've had pretty similar reactions. And so I feel like it is kind of a good baseline to kind of base how you might be feeling and how to prepare. So I'm really just going to talk about just all the side effects. And again, I have had 2 of 6 of my infusions, so I'm not all the way done. And I will probably do another updated video if things change, like if there's side effects I didn't experience right now, but I'm will later on. I'll probably update this video. But right now, if you're getting ready to start TCHP and you're just curious about my experience and the side effects, I'm gonna kind of go from literally from head to toe on how the side effects have affected me. And then I have the list here that my doctors gave me of each different drug and then the possible side effects. And I'll kind of run through them real quick and see if there's anything I forgot or point at the ones that I haven't experienced yet. So again, TCHP, the T stands for taxoterol, the C is carboplatin, and then the HP is Herceptin and Perjeta. And the Herceptin and Perjeta drug, for me, I've chosen to get the shot instead of it being infused because I will be getting that shot for a year. And instead of being, taking a couple hours in the infusion site every 3 weeks, I'd rather go in for a 5-minute shot or, however long it's going to take, maybe 30 minutes total from start to finish. So TCHP is the chemotherapy that I'm getting. So I'm just going to start in general, side effects from head to toe. And right now, I don't really know which drugs are causing which side effects. And then I'm also have to take other medications, not a lot, but steroids, and steroids can cause some of these side effects, or getting dehydrated, and it just kind of all related. But I'm just gonna go ahead and start from head to toe. So the first one, starting with my head, my scalp, is hair loss. And I think it's 80% of people or something will experience hair loss with this. But then with everything combined, I think 3 of the 4 drugs mention hair loss. And so it's kind of inevitable that you're gonna have hair loss. And so I started losing my hair right at 2 weeks. I have a whole video about it, 2 weeks after my first infusion. And now I'm getting ready to start my 3rd. So it's been 6 weeks. And I am pretty much have lost, this is just red from my hat, pretty much lost all of my hair. I did cut it short and then shave it and then shave it the 2nd time. And so that's what we're dealing with right there. It is a little bit tender, when the hair is falling out. Right now it's not as much because there's not much pulling, but it is a little bit tender, but not that bad. Nothing I would ever need to even take an aspirin for. Okay, moving on to the rest of my face. So you could lose your eyebrows, your eyelashes, nose hair, ear hair, everything. Another thing is, whole body wise, is dry skin. And I haven't had it too much, but I bought some lotions and things, make sure I moisturize. And I've always used a really mild face soap. And so I've just continued using that. And even with my hair, I've always used a really mild shampoo and conditioner because I had curly hair. I didn't use harsh chemicals very much. And I did a diffuser on it. But anyways, so all of that stuff, I don't know why I'm talking about the hair thing. That's supposed to help with hair loss, but it didn't. Dry skin. So skin's dry all over your body. I've noticed it in my hands a lot, even on my palms of my hands. But I been moisturizing, and anything I buy, I've been using sensitive body wash and hair wash. Also had really dry nose, especially after the first infusion. first I noticed my nose was constantly running, but like I wasn't congested, it just was like running a little bit. And then my nose got so dry that like I had to put like Aquaphor in it, and I bought some like saline nasal stuff to help. After the first one, it was the worst, and I didn't have those things on hand, so like I had to like order them on Amazon and like get them shipped here. But after my second infusion, I kind of like, as soon as I started to notice my nose getting dry, I started using some of those things, and it wasn't nearly as bad. But extremely like to the point my nose was so dry it was like raw and bloody. Also, and again, this was really the worst after my first treatment. And same thing, I didn't have all this, I didn't have a lot of the supplies. I knew it was a possibility, but I just wasn't all the way prepared like on my research. And so my mouth got really dry to the point I started to get a little bit of sores. But after my second, it didn't get nearly as dry because I had things that I could use to help. Drinking, like sipping water throughout the day is really good. And then I had some like mouthwash, and they suggested that you rinse your mouth out like after every time you eat with like water, baking soda, and salt. And you know, almost everyone has it on hand. So I like filled up a little Gatorade thing, and now almost every time I eat or if I'm in the bathroom, I just do like a quick mouthwash, just like a tiny bit. And that has seemed to really help too the second time around. My lips also are pretty dry, and my eyes are really dry too. I'll get like, even like, I don't know, it's like sometimes they're dry, but then sometimes they're really watery. I don't know. I do have a doctor appointment next week. I haven't been to the eye doctor in a long time, so I'm gonna have an eye doctor appointment next week to get my eyes checked, because I have noticed, and this is something that could happen, a little bit of vision change. And so I just want like a baseline of where I'm at with my vision so we can like monitor it. You could get cataracts. I don't have that, I don't think, but I have noticed like focusing on things up close. I'm far nearsighted, and so normally I don't have that problem, but and I'm only like a tiny bit nearsighted, not even that much. But I've noticed I couldn't like focus on things up close, and it was worse this last time during the week of chemo. And so that could be a combination with like sleep deprivation, or I don't know, other things going on, but it was enough for me to make a doctor appointment, eye doctor appointment. Moving on to like my muscles. I noticed this the first time around, but I did have some like muscle pain, mostly in my legs, and a little bit of like bone pain in my legs. One medication they're having me take during the week of chemo is Claritin, because Claritin is supposed to help with bone pain. And so I noticed it the first time. I didn't quite notice it as much the second time, and it was like very mild for me. Again, just like dry skin. And then moving on to my stomach. Oh, that really has been a really big one. And I don't know if it's how long it's gonna last, but like diarrhea and nausea. And the diarrhea has been way worse than the nausea. I've barely been nauseous, just at times, but really bad stomach cramps and bad diarrhea to the point that I got really dehydrated, and I just have to like make sure that I like drink a lot of water. And when it gets really bad, you know, you feel gross and you don't feel like eating, but I have to like make sure that I eat to make sure I don't get dehydrated, because if you get dehydrated, then everything kind of just gets worse, like everything. And so it's important that you try really hard not to get dehydrated, and I didn't this second time, as I've mentioned in past videos. Moving on to, okay, so like your nails can also, they kind of stop growing, and then you could get like nail bed problems. I haven't noticed too much of that, but I've been using a nail hardener. I got a manicure like a couple days before my first infusion. I got a manicure and pedicure, and then ever since then, I'm not really using any polish except for a hardener, and it's like shiny. I think it looks really good though. But I have noticed a little bit, just like my cuticles on the side, and my nails like they're just really sore. It's kind of weird. Like I think they might be super dry, and then I did get a couple like sores on my cuticles, and I just made sure that they didn't get infected, and just like kept an eye on it, because you don't want anything to get infected. Okay, sorry, my husband came up. I was chatting with him for a minute. So along with your nails, that could also happen to your toenails, and I haven't really noticed anything with my toes. And then general loss of appetite, and it gets better. And then general loss of, extreme tiredness and like a lot of brain fog. So I'll kind of go over now the other symptoms. And for me, it definitely is like the first, 2 treatments, they had like a similar pattern, and I'm hoping this third one has the same pattern. I'm really praying for that. And then like by like a week and a half, I feel 100% normal. And so I have like another week and a half of feeling great before the next infusion. And so in the worst, there's probably like 3 days where it's the worst overall. Like the tiredness is worse, but then the stomach stuff is constant, unfortunately. And I'm really hoping that isn't the one I'm gonna be having for a year, but I feel like it might be. So I'm gonna go over the side effects that the doctors kind of gave me. And I remember getting this for the first time, and it was pretty overwhelming, just like reading all of this, and yeah, it's just a lot. So the Taxoterra, bone marrow suppression, and so that's why they're giving me, I think, the arm injection. And the bone marrow suppression has to do with like your white blood cells and your red blood cells and your pellets, and so that's why I get my blood drawn every time, so they can like keep track of that. But it raises your risk for infection, makes you feel tired and weak, and can raise your risk for bleeding, like I don't know, bleeding, I guess. And so that is a big one that they're like concerned about, and they like keep an eye on. So bone marrow suppression, red, white blood cells, and that, I think some of the other medications have that as well. Fever, it kind of goes along with the other one. Soreness of your mouth, you may have like white patches in your mouth or a sore throat, mostly like kind of dry mouth. Nausea and vomiting, constipation, diarrhea, infection. So they really keep you an eye out for infections, and like if you get a cut, you want to like make sure that you take care of it. If you don't want to get sunburn, you don't want to like get ingrown hairs or anything like that, things that could easily, because you're at a risk for infection. Swelling of your legs, ankles, or feet, or fluid buildup around your lungs or heart or elsewhere. I have not noticed that. Changes in the way food tastes and how drinks taste. I definitely have noticed that, and it was worse the first time than the second time. And things just did not taste good, and my taste buds have just changed. Like I don't really like hot coffee that much anymore, and sweets just taste a little bit different to me. And I go through periods where it's worse, then it gets a little better. Effects on the nerve called neuropathy. I have not noticed this. I'm thankful for this. It's like tingly and like numbness in like your fingers and your toes, and sometimes that doesn't go away. My plan is, if I do start to notice that I'm going to buy, you can like ice your feet and your hands during the infusion, and that's supposed to help. And so if I do start to feel that, that's my plan, is to buy like the ice kits on Amazon and do that. I don't want to, because it just sounds like cold. I don't like being cold, but if it's gonna help with like that, because like it makes it almost so that, from what I understand, you can't really even use your fingers very well. When I was pregnant with my first, I did get a little bit, I thought it was more carpal tunnel, but like my fingers would fall asleep. Like even if I was like washing my hair in the shower, after like having my arms up for a little bit, my fingers would start to like fall asleep, and then even like my arms. I don't know if it's like that or not, but I remember that being really annoying. And so I definitely don't want to mess around with that. Decreased appetite, I had that. Weakness, yeah, overall, yeah. Pain, I didn't have much pain. Muscle pain, trouble breathing, didn't have that, but like if you do have that, that's something that would be on the list. Like call your doctor. Changes in your nail color, you may have nail loss or brittle nails. That's why I'm using that nail hardener. Hair loss, got that going. Allergic skin reactions, so like blisters on your skin that are full of fluid or severe red. Now that I think about it, I have had a couple like random blisters on my skin that I was like, where did this come from? Like I had one on my foot, and then I don't know if I still had it, but no, it's gone. I had one like right here, and it wasn't like a pimple, but it was just like a big red, almost like a hive. And the one on my foot, I thought it was like ingrown hair or something, but now that I read that, that's probably what it was. It didn't hurt, really. Allergic reactions, like to the drugs themselves. So that is for the Taxoterra, the T. Carboplatin, side effects are bone marrow suppression, like white red blood cells, nausea, vomiting, weakness, changes in your liver function or your kidney function, electrolyte change, pain, and then neuropathy. so like the fingers and toes numbness and tingling. So the Herceptin and Perjeta. So again, instead of getting those infused, I chose to get the shot, and the shot I'm getting is called Phesgo, Phesgo, so Phesgo, I think. And side effects from that are decrease in the number of white and red blood cells, nausea, diarrhea, tiredness and weakness, effects on your nerve called neuropathy, rash, and hair loss. So you can see like 2 out of these, or this last one reading is like 2 drugs in one, have hair loss. And so it's kind of like, that's why I'm definitely gonna lose my hair. I remember a lot of people saying, maybe you won't lose your hair. And I was like, the doctor said I'm gonna lose it. So I don't wanna like, I just want to plan to lose it. So that's what we did. That's what happened. So I also had like a list of things I'm gonna go over of when you should call the doctor. And your doctor may have different, like a different plan for you, but this was like the general one that like if I had any of these symptoms, then I needed to call the hospital like hotline and talk to the oncologist on call. And she said, do not send a message in the portal or email me because like that takes time. But like if we call like directly, you could talk to someone who knows. And so a fever over 100.5, bleeding or unusual bruising, burning or pain when urinating, constipation for more than 2 or 3 days, diarrhea 4 or more in 24 hours, nausea, vomiting if you can't keep any liquids down, pain not controlled by your medications, redness, pain, sores, or white coating in your mouth, shakes and chills, unusual cough, sore throat, lung congestion, shortness of breath, chest pain, or any symptoms that we're concerned with linked to our chemotherapy. And so I did have to, my first time, call like 3 times in a couple days, and that was for like stomach problems. And they were able to help me like get that under control. And the second time, I didn't have to call at all. So that is kind of my experience so far with TCHP, with the HER2 positive cancer. And again, you may have something different, but this is kind of just my like thoughts so far in it. And just the only other 2 I'll like highlight real quick is I did get a lot of headaches, mostly after my first one and a little bit the second time. And when I talked to my doctor about it, she said that also could be related to dehydration. And so I think that's why I didn't get them as bad the second time around. And the other thing is like brain fog, or they call it chemo brain. It's really hard to explain, but you just like don't feel mentally with it. Like it's hard to concentrate, and it's hard to even like form sentences sometimes, or like remember words. I would get really overwhelmed by things really easily, and yeah, it's really hard to explain, but it is really impactful. And it was like, I don't know, it's something I really don't look forward to, because yeah, I'm not looking forward to that again. But it does get better, and it doesn't like continually last the whole time, you know, like especially if you can keep yourself hydrated and not get dehydrated, it just helps all of your symptoms overall. So again, that's my experience. I may update later. Thank you for watching. Good luck. I'll be praying for you. Leave a comment about when you're starting, or if you've gone through this cocktail of chemotherapy drugs, and you know how you reacted to it, or some of your side effects. But yeah, it's not fun, and it's not fun with 2 little kids at home, but gotta do what we gotta do. You know, I have to be around for my kids, so I'm gonna do this. Thank you for watching, and good luck with your treatment as well.